You could be one of millions of people who suddenly have high blood pressure.
Yeah, things have changed. The American Heart Association unveiled some new guidelines today that actually lowers the target blood pressure level. NBC Connecticut's Jamie Ratliff here now with new information doctors are hoping will save some lives. Jamie?
Yeah, this is all about saving lives, Keisha and Jerry. High blood pressure significantly increases the risk for heart disease and stroke. Now, before these new guidelines, about 1 in 3 adults in the U.S. were categorized as having high blood pressure. Well, now it's closer to 1 in 2. And for those affected by this, doctors say there are steps you need to take.
When I heard about it, I thought about my blood pressure.
Tonight, millions of Americans are being told to look at their numbers. This after the American Heart Association and others gave a major overhaul to blood pressure guidelines.
It's very clear that their future risk of heart attack and stroke down the road is nearly doubled compared to patients with lower numbers.
Previously, 140/90 or more was considered high blood pressure, but now it's 130/80. Normal blood pressure is less than 120/80.
We're going to have the conversation with more people about how to treat hypertension.
It means 14% more people now diagnosed with hypertension. Experts expect the new guidelines will greatly impact younger people, with high blood pressure expected to triple among men under 45 and double among women under 45. Cardiology director for the Heart and Vascular Institute at the Hartford Healthcare Corporation at Midstate Medical Center, Dr. Bill Farrell, says those impacted will need to see their doctor. Those considered high risk will need medication, but for the majority of Americans affected, it'll be about lifestyle intervention.
Whether it's diet and exercise, reducing salt in their diet, controlling their weight.
It will probably make people more proactive if they have slightly high blood pressure.
And with high blood pressure called a silent killer for preventable heart disease and stroke deaths, early intervention is key.
And Dr. Farrell says something important to point out here is that blood pressure is not a single number you get either at a doctor's office or at home. So it's important to get it checked at least 2, maybe even 3 times. In some cases, it can take dozens of times.